Have you ever wondered where the problems in the world today would exist if we had deeper connection to ourselves, others, and the environment and acted from that place? Welcome to the Conscious Action Podcast with your host, Brian Berneman, who believe that connection is the key to taking conscious action as individuals and creating a better world. We are here to raise awareness and inspire meaningful action by sharing stories, knowledge, and conversations with thought leaders and change makers. From sustainability to well-being and everything related to conscious living, our mission is to empower you to be the change that you want to see in the world. Welcome to a new episode of the Conscious Action Podcast. I am Brian Berneman, your host, and for this episode, I wanted to explore the importance of integrating holistic practices into healthcare. So this is one of the spaces that I know from working with a lot of professionals in the healthcare space that there's a lot of people that are struggling. There's a lot of pressures. There's a lot of different ways that people are, like working too many hours, not enough pay, working with sometimes like people that might die or that are going through something challenging. It is not an everyday easy space to work in. So I just wanted to bring a little bit of the perspective and one of the things that I've been doing with some of my clients to support you, if you are a healthcare professional, to incorporate some holistic practices into your day to support you. This can also be helpful for anyone working in any field, but I wanted to focus on this field because it's important to understand how we as practitioners can show up differently for our patients if we are well, if we are not stressed, if we are not tired, if we are not overworked. So there's a few different things that I think that are important to understand, that if we are going to care for others, we need to make sure that we care for ourselves first. I usually talk about the airplane and how we are always suggested to put our mask first on before we help others. And in this space, it is really important to make sure that we are adopting practices that support us to deal with the stress, to deal with the pressures, to deal with everything that is taking place, and to support our own well-being, and how that then can create a very different environment, and the care of our patients can change dramatically if we are introducing a shift in how things are done for ourselves and for everyone that works with us. And one of the main things a lot of times is that I keep on talking with people and businesses about this, the fact that we are focusing on ourselves, our mental health, our physical, emotional health, our spiritual health, doesn't mean that we are not caring about the work or the result or the productivity. We actually do. When we are well, we are actually doing better in that regards. And also, we can bring, as we're doing that, more compassion to the care of our patients. We can bring that into the space, and that makes a huge difference. And there's plenty of studies nowadays showing that there's an increase in resilience in the professionals who are incorporating different practices like yoga or mindfulness or breathwork or different practices to support what they are doing. So a lot of times with people that are in a quite full schedule and their work needs them to be all of the time on, what I suggest always is introducing practices that are easier to build into your day or to hook into something that you're doing. So, if you're having a shift, then having different meditation or mindfulness practices that are short, that are supporting you to like be grounded and, to understand, okay, as I'm during my shift, can I pay attention as I'm doing my work to my breath? Can I pay attention to what's going on around? Can I pay attention to the type of thoughts that are rising? So just practicing, like quick, short, like breathwork practices, some grounding exercises using the body to just move and to make sure that we are present in the body so that any stress that is building up, but we can move it, creating mindful moments, perhaps in between seeing some patients or some meetings, just to be able to stay a little bit more centered, a little bit more present, a little bit more aware. Creating enduring breaks, perhaps creating movements, just allowing the body to move, to stretch. It can be practices that are really nice and subtle and slow, or it can be something a little bit more invigorating if you need that. But when we are doing a lot with the body, when we have long hour shifts, and when we are, doing perhaps similar type of work, we need to bring the body into the equation and just give it some break to the body, move it, stretch it, allow it to do something different. Making sure as well always that, we are hydrated. So, making sure that we're drinking plenty of water, that we are eating a nice, balanced, diet, that whatever it is that you're choosing to eat based on your values, making sure that you're eating a balanced diet, like towards whatever you believe is healthy, allowing that to be what keeps you more energized and keeps you going instead of putting your energy down and having to all of the time just drag yourself to what's next and pushing yourself. So making sure that you're drinking enough water during the day and that you're eating healthy food allows you to have that extra little energy boost in a sense. And when we incorporate as well this can change the culture of our workplace. Because when we start to incorporate well-being and mental health as a priority, then this can have a ripple effect at work. Perhaps you start to incorporate this in practices that you do together with your coworkers. It doesn't need to be just you doing something. It can be something that you take to the rest of your team or to your colleagues and, try to incorporate it into your work as something that actually is going to make you be able to be there for your patients and to do your work more productively and more effectively. And when we create that space that supports that, then we're able to actually have a connection with everyone else. And we don't need to do this by ourselves. So, like you can have that support system because if you are meditating together or if you're doing some practices together with your team, then it's not you doing something different or weird. It's just you doing something together with your colleagues, with your team, to be able to make sure that everyone is okay and that everyone matters and their health and their mental health matter as much as the patients. When we're able to do that, then we're able to change a little bit how things are done at work again. So, sometimes we do need to bring into the workplace an external person. That's part of the things that I do sometimes, that I go and I work and I give tools so that then they can do it by themselves. Or perhaps you already know what to do and you just need to, talk to the people in your team and see how do you incorporate this. Can the administration or the managers, like put some emphasis into making sure that this as well is a priority at work and how that can help so much, whether that is by, giving access to some classes or some workshops or some talks or one-on-one support with mentors or therapists or counseling or, like access to well-being apps meditation apps, perhaps. So there's a lot of different ways that can support doing that. And one of the main things a lot of times with this is that we need to shift the narrative, as I was saying. We need to put ourselves first. We need to put our mask first on before we help others. And in the healthcare system, most of the emphasis is on the patients, is on the others. And it's wonderful. It is needed. And also, you matter. You actually are important. And if you're not well, you cannot give everything to your patient. And that is my why. Why? Not only it's because you matter, it's because for your patients, you're going to be able to be so much more if you are well. As I mentioned, you're going to be much more understanding, empathetic. You can bring more perspectives. You can ask them, about the different aspects of themselves, their mental, emotional, physical, spiritual, like all of their different aspects, and not just one of the aspects that perhaps is what they are focusing on based on a symptom. So, you know, there's a lot of different reasons why doing it. And then there's a lot of different challenges, of course. As I mentioned earlier, the time, the shifts, like when you're too busy and work is going, 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 it seems that there's no time to do it. So this is why incorporating some short, quick practices can support you. And of course, outside of work, the more that you're able to incorporate some practices, then that's going to start to lead and to actually become part of your everyday life. So then once you're at work, you're able to actually show up with more presence, more awareness, with different kind of energy. So understanding that, yes, there's a time constraint, and also we can incorporate small little things in between the patients, or in the moments that we're taking a short break, we can actually do things without disrupting our workflow. So allowing that to be part of what is incorporated is important. Then the other thing that is important is to be able to, create a shift that sometimes it's not that easy in the culture that we're in, to prioritize our mental health, our self-care. Because as I said, this isn't, something that we're wanting to, this would be a luxury. No, this is necessary. So we need to start making a shift so that there's a change culturally and not just on ourselves, so that then that is more supported. So again, there's a lot of research done on this in different places that is showing really good results. And I think that as well, like out of the personal experience that I have, that is really important in understanding that. And as well, making sure that it's easy to access things. So if as a team, you actually have, access to counselors or to an app or to a class, even if it's once a week or something, then it makes it easier. So when resources are poured into the spaces of actually caring for the carers, then it makes it easier to actually do things. Because if not, the status quo will show you perhaps that, nobody else is doing this, so like I can't do this. I can't prioritize my health and my well-being because nobody else is doing it. We need to understand, okay, there's things that have been done and have been normalized. They are not good. They do not work. And people will get burned out, which is what I keep on seeing. So to prevent that, we need to create that shift. So just slowly either incorporating or being able to be the one that creates the shift in our space. So being able to be, in a sense, the one with courage, or the leader that actually invites our coworkers, our team, our colleagues, the administration to create the change. That's going to be really, really important. So once again, you matter. You actually are important. And self-care is important, especially for those that are caring for others. So, the more that you prioritize yourself and the more that you bring different holistic practices into your everyday life, the easier it is for you to be in a more supportive way, less stress, and creating this ripple effect that is going to support you, your team, your patients, and their families. So I do invite you to actually try this out and see, like start with perhaps one practice, just focusing on your breath or focusing on some mindfulness practices or doing one meditation class a week. Start small so that you can actually create and understand that this is a process, this is a journey, and that it takes, ongoing practices with different, perspectives, because we're all different. We all need slightly different things to understand what's that journey that you need towards a more sustainable well-being, because we don't want to overwhelm ourselves. We want to make it more sustainable. So creating that sustainable pathway for your well-being is really important. And that as well, your professional life as well is longer so that you're not burning out and you're able to be more productive, more efficient at your work, whilst being well, whilst caring for yourself, for others, and for your patients. So I would love to know if you're in the healthcare system, do you do anything? How is it at your workplace? Do you already incorporate some holistic practices into your day? If you're not in healthcare and you're still, stressed out, burning out at work, or the people around you are like that, you can still incorporate the same principles. I work a lot with people in businesses and with, individuals to change how they are showing up at work and to create a shift towards well-being. And that leads for businesses, organizations to actually function better because we are functioning better. So I'd love to know. Give me a comment anywhere that you're finding this episode. And thank you, as always, for being here. And I'll see you in the next episode. Bye.
What did you like the most about this episode? Take a moment to think about what change you can make in your life today.
Share your conscious action on social media using #ConsciousAction and tagging @ConsciousActionNZ so we can celebrate your impact on the world and create a ripple effect.
One easy action we would love for you to take right now is to share, like, and subscribe to this podcast. This will help us get these messages out into the world and inspire more people to take conscious action in their own lives, contributing to the better world we hope for.